Welcome to the Certified Diabetes Educator session. I'm Kirsten Ward, Registered Clinical Exercise Physiologist and Certified Diabetes Educator. I am a member of the National Certification Board for Diabetes Educators. Today's session is geared towards the exercise professional, specifically the Registered Clinical Exercise Physiologist and the Clinical Exercise Specialist. Before beginning, I would like to provide some disclosures. I currently work with Roche Diagnostics as a clinical specialist teaching insulin pump therapy. The presentation that I am going to show in no way represents Roche Diagnostics. And a little bit of personal information, I received my diabetes education and training at the Joslin Clinic in Boston. Certified diabetes educators are valuable members of the healthcare team who make a difference in their patients' lives and in their communities. The CDE credential is the embodiment of a true professional, and the CDE serves as the patient's mentor, confidant, cheerleader, and coach. I love being an RCEP, but I must say I've had opportunities come my way as a CDE that would have never happened had I not pursued this credential. Today we will discuss the NCBDE mission, the CDE credential, eligibility requirements, the CDE exam, and how to renew your CDE credential once you receive it. The mission of NCBDE is to define, develop, maintain, and protect the certification and credentialing process to promote quality diabetes education. So what is NCBDE? It's an autonomous nonprofit certification organization governed by a board of directors. We are volunteer CDEs and one public member. There are a variety of committees, and this is a great way for CDEs to start volunteering and getting involved. Several of the committees you can see here on the slide, the Examination Committee and the Credentials Committee. The year of 2014, I will be working as the chairperson for the Outreach Committee. NCBDE is not a membership or dues-paying organization. There is actually a lot of confusion and misunderstanding about this in reference to other organizations in specific to diabetes. ADA, which is the American Diabetes Association, and AADE, which is the American Association of Diabetes Educators, are both dues-paying organizations. The purpose of the CDE program is to conduct certification activities in a way that upholds standards for competent practice in diabetes self-management and education. Why earn the CDE credential? Well, there are a variety of reasons. One may be to achieve personal and professional goals, and it's a credential that's highly respected. It's another way for you to demonstrate your diabetes knowledge to your peers. And it's the least you can do for your patients to have that extra knowledge and expertise to help improve their outcomes. It's also something that you take with you from job to job. As I said earlier, I've had a variety of opportunities. I've been able to travel to India, Mexico, Colombia as a guest speaker. I've been a consultant on a variety of webinars or TV projects. I've been a program coordinator, and I've had a variety of industry jobs as well. So what is the CDE? A certified diabetes educator is a health professional who possesses a comprehensive knowledge of and experience in prediabetes, diabetes prevention, and management. It's someone that supports people affected by diabetes to understand and manage the condition, and it promotes self-management to achieve individual behavioral and treatment goals that optimize health outcomes. Who is currently certified as a diabetes educator? Well, you can see that the majority of CDEs are nurses and registered dietitians. There's a few RPHs, and the other category is where you'll find us, the RCEP and the CES, and advanced degree exercise physiologists. So you can see that there's a paucity of exercise professionals. And just as an aside, When we talk about diabetes education to patients, we always talk about three things. We always talk about medication, nutrition, and physical activity. Right now, in the United States, there are 45 CDEs that are exercise professionals. So we definitely need more. And that means there's a lot of opportunity for you. The CDE certification is different than an entry-level credentialing process where prior to an exam, the individual only needs to do the academic requirements, such as a nursing license. It's not intended to serve as an entry to the specialty. It's actually a mastery level practice-based certification and requires individuals to accrue professional practice experience prior to applying. You can think of it as a nurse that has received the license, and then after receiving the license, they go on for a further specialty, such as an ER nurse or a pediatric nurse, etc. So to clarify, once again, this is a mastery level credential. Practice experience is necessary in order to master the knowledge and application of that knowledge associated with the specialty. And this is partly because the knowledge is not provided in academic skills. Learning is basically on the job, so practical experience is needed. The examination is geared and designed for health professionals who have responsibilities that include the direct supervision of diabetes education as defined by NCBDE. You are not required to have the title Diabetes Education in your job to accrue this experience. Diabetes education, also referred to as diabetes self-management education or diabetes self-management training, is performed by health professionals who have appropriate credentials and experience consistent with the particular profession's scope of practice. For purposes of this presentation, the term diabetes self-management education, or DSME, is used. To be eligible to sit the CDE exam, there are several criteria that will be needed. The first one is a discipline requirement, and this is for individuals holding active certification as either an ACSM Certified Exercise Specialist or ACSM Registered Clinical Exercise Physiologist. You may also still qualify under the unique pathways in 2014, and we'll discuss this further during the question and answer section. After receiving your CES or RCEP certification, you will then be able to accrue your professional practice experience, and this is comprised of two components. The first one being a minimum of 2 years of professional practice experience in the discipline under which the individual is applying for certification. So this is, as an example, working in a cardiac rehab setting, working in EKG stress testing lab, working in a back pain clinic. You do not need to have diabetes educator in your title. You will also need to attain a minimum of 1,000 hours of professional practice experience, whereby 40% of those hours are accrued in the most recent year preceding the application. We're also pleased to announce in 2014 that these hours may be volunteer-based. They do not need to be paid hours. Let's now take some time to discuss what is diabetes self-management education. There seems to be a lot of misunderstanding when speaking to people about this. So the definition of DSME: it involves the person with prediabetes or diabetes and/or the caregivers and the educators, and is defined as the ongoing process of facilitating the knowledge, skill, and ability necessary for self-care. It is a component of a comprehensive plan of diabetes care. It's the process which incorporates the needs, goals, and life experiences of the person with prediabetes or diabetes and is guided by evidence-based standards. The overall objectives of DSME are to support informed decision-making self-care behaviors, problem-solving and active collaboration with the healthcare team, and to improve clinical outcomes, health status, and quality of life. For purposes of eligibility, some or all of the following components of the DSME process may be performed and counted towards meeting the practice requirement. An individual assessment and education plan developed collaboratively by the individual and educators to direct the selection of appropriate educational interventions and self-management support strategies. Educational interventions directed toward helping the individual achieve self-management goals. Periodic evaluations to determine attainment of educational objectives or need for additional interventions and future reassessments. And a personalized follow-up plan developed collaboratively by the individual and educator for ongoing self-management support. Now, just to clarify for one moment, there are a lot of diabetes education classes, and this can be included as diabetes self-management education. However, if you have 6 people in a class, that does not mean it's 6 hours of diabetes education. It's still only 1 hour of diabetes education. Another key component is documentation. You will see documentation in the education record of the assessment and education plan and the intervention and outcomes. In addition, program development and administration provided in support of the diabetes patient education program are considered a part of the DSME process. Oftentimes you will hear diabetes educators that will record following up by phone. There's a lot of phone follow-up on blood sugar management as well as blood glucose interpretation. All of this is included within diabetes self-management education. So regardless of your discipline, the knowledge and the ability to apply that knowledge is necessary. In addition to your professional experience, you will also need to have continuing education. So a minimum of 15 hours of continuing education activities in the diabetes field is needed within 2 years prior to applying for your exam. Eligibility-wise, of all the requirements, most questions focus on the 1,000-hour DSME practice requirement. We all know that exercise is an important component in helping people manage their diabetes. And as I said earlier, you might find a CES or RCEP working within cardiac rehab and doing diabetes education. So how do you know if you're doing diabetes education even though you're in a facility that's not geared for diabetes education? Let's go into that now. Am I doing DSME? Questions you may consider. Have you reviewed the definition of DSME? Have you spoken with your supervisor about it to get their feedback? Your supervisor is the individual that you must verify your experience if you're audited when you apply. So it's important that you're both on the same page. Have you looked over the examination content outline? The outline is built on a survey of what CDEs are doing in their jobs. And when you review the outline, you may identify many activities you're already performing in your work setting. If you're still not sure, here are a few more things to think about. Does part of your role include patient education and counseling? Do you work with patients with diabetes? Is there documentation of your work with the patient in their record? If you're still not sure, here are some examples to think about. Do your patients with diabetes receive the same educational content as those without diabetes? If so, this would not be considered DSME. But if you teach those patients how diabetes medication impacts blood glucose levels or explain the hypoglycemia risk associated with physical activity, then this would be considered DSME. If you're still not sure, here are some more examples. Do you simply teach an individual how to use a blood glucose meter? Again, not DSME. Or do you provide guidance when teaching the meter about blood glucose goals pre and post physical activity? This would be considered DSME. Now let's review the examination application. Applied Measurement Professionals administers the examination process for NCBDE, including application submission. And most people can apply online using the AMP's website, or you can go to the NCBDE website. The initial fee is $350, and to renew, it's $250. Applications are accepted within 2 application windows annually, so there is a spring and a fall session. Once you receive your confirmation, you may make your appointment using an online option. The exam is a computer-based test offered at 190 different test centers. It will be based on the examination content outline developed from the 2013 Practice Analysis Survey of CDEs about tasks they perform. Each question is linked directly to a task or tasks on the examination content outline. The exam is 200 multiple choice objective questions, including 25 pre-test unscored questions. You will be given 4 hours to complete the exam, and normally score reports are provided when you finish the exam. To prepare for the exam, I suggest reviewing the exam content outline. Look for areas that may not be part of your day-to-day experience, such as diabetes education program management or wound care. You may also want to consider your typical patient and study aspects of the exam content outline outside of that profile. For example, if you usually work with adults, think about studying some of the pediatric patients, or if you commonly work with type 2s, study more type 1. Again, there's no specific course or study guide because everybody comes from a different background. So there are a list of references in the handbook, and that's what I used and utilized for my study. As I mentioned, there's a variety of references and resources that you will find in the handbook. And if you're nervous about test taking, I recommend the practice examination. It kind of gives you an idea of what the exam will be like and what the questions are like. It's only $55 and it gives you 50 questions. Once you receive your CDE credential, I'm sure you're not going to want to let it expire. The renewal is in a 5-year cycle and it must be completed during the year of expiration. It also includes a practice requirement, though definition of practice is expanded. And if practice requirement is met, renewal may be done via examination or continuing education process. One other note that's important to remember is that you need to maintain your certification as a CES or RCEP. If that expires, then you will no longer be considered a CDE. I hope this presentation has answered your questions about the CDE credential and the examination process. But if it has not, you may contact NCBDE directly by calling 877-239-3233 or 847-228-9795. Thanks.